Welcome back to It's Your Case, presented by VetCT.com. I'm Heather, your radiologist on demand for this week. Today's example is a follow up from last week. You'll recall that this young cat has a terribly displaced physeal fracture. Today, I can show you the postoperative study. Here you can see a craniocaudal view of the physis obtained after surgery. I will touch on a few points about postoperative use of radiographs to assess adequacy of fracture repair. I still, of course, always stick to my ABCDs: alignment, bone, cartilage, devices, and soft tissues. Alignment becomes a big one when we're looking at postoperative fracture repairs. In this case, for sure the fragments have been brought together really well. We can see that on the craniocaudal view, there's really good alignment of the femur. I'm going to look at the lateral view also. Here you can see on the lateral view that we have decent alignment of the cortex. That little metaphyseal fragment that we found that caused us to categorize this as a Salter-Harris 2 fracture looks like it's in fairly good alignment as well. What I do want to continue on when I'm assessing alignment after a fracture repair is alignment of the joints. Even though this wasn't an articular fracture, bringing two fragments together can impact the alignment of the joints both above and below the fracture. In this case, I'm going to focus on the stifle joint. What I'd like to see when stifle joint alignment is exactly right is that the midpoint of the femoral condyle, which I'm going to kind of roughly make as a star here, would be approximately in line with the midpoint of the tibial plateau here. So in my opinion, there's caudal rotation of this distal fragment, with the femoral condyle now being slightly caudally rotated relative to what we would expect for a more normal anatomic alignment of the stifle. This can actually be a concern with this fracture type in particular, so it's not overly surprising to see it on the postoperative studies. We would also continue to look at bone. Sometimes, after a fracture has been repaired, the surgical procedures can impact bone around it, so we make sure that there are no additional fractures seen. I moved up a little bit just to make sure that the hip was still appropriately placed. Occasionally, really substantial intraoperative manipulation can reveal other soft tissue or bone injuries that weren't evident on the preoperative study. As I look around, you may be noticing that the soft tissues, in addition to being really thick, contain gas. You'll recall that this was an open fracture, so this patient would need to be treated as if this entire area were infected. The last thing in our ABCDs is devices. We don't always get to look at devices, but in this case we have the opportunity. Now, one of the challenges about being a teleradiologist is we're often assessing a fracture that we weren't directly involved in repairing. I think that interacting with the clinicians that repaired the fracture is a really important thing, but I will make a few points. The implants that have been placed to reduce this fracture, although they've brought it into good alignment, you can see that the amount of the metaphysis that's engaged with each of these implants is fairly small. The implants are also engaging at a very sharp angle, which can cause difficulty with ongoing growth at the physis. So it's very good that these implants don't enter the joint. We can see that the femoral condyles do not have implants, and that can be a really tricky thing when trying to drive an implant across these distal femoral fractures. So to summarize, we would conclude that there's been internal fixation of our right distal Salter-Harris 2 fracture. The fragments are in good alignment overall, but we do see on that lateral view some of this caudal rotation of the condyles at the stifle joint. And I have a little bit of concern that the implants are too short, but I would temper that with the knowledge that I wasn't involved directly in repairing this fracture. I will share with you that eventually the surgeons on this case came to a similar conclusion, and in fact they decided over time to replace the implants with slightly longer ones. I'm just going to show this one view quickly. I want you to notice that the soft tissues of the thigh have become thin. This can happen during fracture repair, especially if the animal is inadequately using the limb, as with certain fracture complications. You might also notice that there's some gas in the soft tissues again. This is because these new, longer implants have just recently been applied. The last thing I'll point out about this fracture is that you can see that over time, and the time that's elapsed here, guys, we're looking at about a month from the original fracture to this revised fracture repair. You can see that periosteal reaction has formed. It's quite common with complicated fractures where substantial fracture reduction is needed for there to be periosteal trauma that can happen either with the initial injury with soft tissues or during the fracture repair itself. So having a little bit of a periosteal reaction can happen even distant from the original fracture site. The other thing that can lead to periosteal reaction in healing fracture, of course, is infection. And we know that the soft tissues initially were infected, although this patient has been treated adequately for that. I'll make one last point, which is that on one view, it can look like an implant is within the joint, but in fact, if we look at the orthogonal view, we'll see that that implant is actually not in plane with the joint on both views. Be sure to review the full report associated with this case. Thanks for listening, and remember, it's your case, so please post your questions on social media.